solutions to lotions, but it gets super confusing and there's good and bad players already in this market. So this is where I want to dive in a little bit more. Your main progenitor cells, your stem cells, break into two main categories. HSCs form your blood components, MSCs form your nerve cell and connective tissue. So even if you're a little bit familiar with stem cell, which a lot of people are now, they've heard of somebody going to Mexico or going to the Cayman Islands or Germany or these kind of places. What you'll often see is people, this one's easier to isolate and keep alive, so they'll sell you huge numbers of these for certain amounts, millions, even up to 100 million. They'll tell you you need tons of them, you need to do all this stuff. When you get the entire best case scenario, you get blood cell components, the hematopoietic stem cells, and the mesenchymal stem cells. So think back to the slide when we talked to you about why going down to another country or somewhere else isn't as much fun as what we can now do right here in America, which is incredible. Okay, and a mental picture, even if you don't take an actual picture of any of these slides for free. Okay, let's go to the next spot there. So two main kinds of stem cells. Why do we need them? When you're born, you have tons of them. When you were a kid and you bounced off the trampoline, you were hurting for a few days, right? In a cast for a couple of weeks, everybody signs it, and then you go on with your life. When you're 40, you fall down or play basketball on a weekend, you've hurt for a long time. When you're 80, you fall down and it's a trip to the emergency room. The only difference is the amount of stem cells. When you're born, you have trillions. By age 40, you're down to 1 out of a million, and by 80, you're down to 1 out of 5 million. So the stem cell counts just keep dropping and dropping and dropping. And so the new science is at what age should we stop that decline? And the new data is just incredible. Why do they drop? Every reason. Everything that's going on in our bodies, in our life, in our stress, in our environment. Everything is changing and we're aging. And the really sad reality is we are now the first group of people that's going to live shorter than the generation in front of us. Lifespan has now gone down with metabolic disease and obesity rates and everything else. But in the middle of that, there's this counterculture of people that are going to be extremely healthy and do really smart things and live way longer. So, questions about where they come from. So throughout your life, you have this crazy problem we're fighting, which is degeneration. Degenerate, the middle name there is genes, all the way down to your telomeres inside of your cells, degenerate and start to break down. The downside is your body prioritizes things. So it wants your brain and your heart and your organs to stay alive. So it'll prioritize those against your joints. So as we age, our knee starts to hurt because your body prioritizes organs. And then ironically, we do what to make our knee feel better. We take next slide. We take a medication to make our knee feel better, which ironically hurts our kidneys, our stomach, and our heart. And then that goes down and it just starts this negative cycle. So the problem is degeneration. Was the solution to medicate? Anybody have a bad medical experience? Tried a drug that didn't work very well? There's some great ones, but the majority of them all come with this risk-benefit ratio of side effect versus benefit, and you're constantly playing this. Should I take this? And then the end of the commercial on TV says, and you might die. Good luck. Go ahead and take the medication. So Pfizer makes billions. Should we operate? Yeah, stem cells aren't going to fix a shattered femur, but they're going to help that femur recover in a whole different way. Operations are super fun. I'm a surgeon. I did all my electives in plastics. I learned how to fix them to make them look really good at the same time. And we still need that, but it is always the best answer. One of the top cancer surgeons in the country left cancer surgery, realizing that this is the wrong end of the equation. He wrote a book called Outlive. I don't know if you've seen Dr. Adi, super cool guy. The idea is that we're catching them on the wrong end when we medicate and operate. So what's the real solution? The problem is degenerate. What's the solution? It's simply to regenerate. Makes more sense than covering it up or cutting it out, right? If you go to your doctor, one of the top orthopedic surgeons I trained with in New York, first day you come in, he has an entire pocket full of his lab coat with injections of steroid. It's like, well, make sure you use them all day. They get paid really well every time they poke you, so they have an incentive to do that. Not only that, but it covers up the pain, so you walk out feeling better. And then the lidocaine and marcaine are chondrocytoxic, meaning they destroy your collagen and your cartilage. So it speeds up the time that you're going to need the joint replacement, which they get paid even more for. It's a great model if you're a surgeon. It's not so much fun when you're on the other end. So is there a better option than covering it up, medicating, or operating? What if we do a regenerate? So quick story here. How I got involved with Red Rock Health Optimization was the guy who's the father of the owner of the Special Forces. It's an incredible book, excited to read through all the rest of it. Jumps out of perfectly good helicopters and for a living, which eventually starts to degenerate your knees and your back. We did stem cells on him not even about almost 8 months ago. Completely regenerated. He was looking at going spending $30,000-$40,000 to leave the country, like all the UFC guys and all these other guys that have knee and bad back pain. And he's looking going, there was something we can do it here. We did that after we did his stem cells. He said, "You're a good surgeon, but come and do this for me full time." And so it's changed how we do this whole opportunity to do it here in St. George. Changed his world. No more knee pain, no more back pain. Then even skydiving blew out his hamstring just because now he feels good, so he jumps out of perfectly good airplanes again. And what should have been a huge recovery did a second boost of stem cells. And in 3 weeks, he couldn't even go up the stairs, and I followed him up to our conference room. He didn't even limp. His orthopedic surgeon had seen him and told him he needed to wear a brace for 6 weeks. 3 weeks later, he was walking again. So the stories get away from him. So let's keep going for it. So, how do we regenerate? We regenerate with cells. Cells don't even care that I give things big names. They just care that there's damage and degeneration. Where do we get our cells? We get our cells from high quality donors. This is how strict our lab is. The birth mom cannot have smoke, drink, piercing, vaping, tattoos, no COVID, or even the COVID vaccine. They test for all epigenetic and genetic qualifiers, and it's the most pristine cells literally on earth. Lab director holds them up. He's like, "These are the best you can get." I know all the top research guys in the world. We make sure we only use the best. It started with my dad. When it's been in our world, it has to be the best. So when you think about cells, you want to know where you're getting them from. Okay, next slide. The next thing you want to know about your cells is where do they come from? So our cells are sourced, like I said, right here close by, because not only can we do the stem cell treatments on these brand new pristine cells, but the new word is not even called a stem cell transplant. It's this. As you get further into the science, you're going to learn more about this word called allograft transplantation. Allo meaning from one human to another human. So you'll see weird things out there with like plant stem cells or animal cells or monkey cells or things that way. You want the best of the best. You want a minute one, right the second the baby's born. It even has to be a C-section. That's how strict they are, because they need to know the minute that baby is born. Once that baby's born, they can isolate the stem cells from the cord that connects mom and baby without hurting mom or baby. Back in the 90s, they played with embryos. We all agreed that was unethical. You destroy life to even help other life. And when you catch it at embryo level, it can grow into all kinds of weird things. Minute one stem cells are technically considered adults in the stem cell world. They're already differentiated adult cells that are ready to go these good things. So we get minute one cells, and we do an allograft transplantation, and it changes everything inside your body. You put these cells in your body, and they listen to these cell signals, and they go out and find damage. It's like when your knee hurts, you take ibuprofen. Any ibuprofen doctors out there? There's this acid that's called arachidonic acid that kicks out. Ibuprofen blocks that and tells you that your knee doesn't hurt anymore. It didn't fix it, right? But it blocks that signal. Stem cells see that signal and say something's wrong, and they go fix it. So when stem cells first came out, they thought, well, the orthopedic surgical world, like if your knee hurts, we need to put the stem cells in your knee. So the old science was inject wherever it hurts. If your back hurts, inject your back. If your knee hurts, inject your knee. Well, when you do surgery on the knee and open it up, it looks like crystal oil. It's crystal clear, and if you rub it between your fingers, the viscosity is unmatched by any synthetic surface. It can do millions of repetitions once again. It doesn't have cells or blood or bacteria or anything else in it. It's pristine synovial fluid on top of beautiful cartilage cells. So if you go inject a bunch of cells into that fluid, the pain goes away a little bit because you push the two pieces apart with just hydraulic dynamics. You can lift a car with a little bit of hydraulics on a jack, right? So you can push those two bones apart and feel a little better. But those cells are in a non-oxygenated environment. And a few of them will migrate to the end and stay alive, but the majority of them don't do well. Which is why studies on injection of stem cells, you'll see them go up and down. New technology says, we had a guy with such severe knee pain, he couldn't do 3 revolutions on his stationary bike, let alone ride a bike outside. He's scheduled for a knee replacement. During that time, when he went to do his knee replacement, his heart was so bad they delayed his surgery to get called cardiac clearance. You have to basically be cleared that you're not going to die on the operating table. So not a healthy guy, right? If you're that unhealthy, you can't ride a bike, you can't clear surgical clearance. In that window was when we just started doing stem cells here in St. George. Did a stem cell transplant. 2 weeks later, he called me and said, I just did 3 miles on my bike. My surgeon brain was going crazy. Like, I've done knee replacements, I've done knee replacements, I've done these surgeries. When it's messed up, it needs to be fixed. Bone on bone doesn't go away. Well, the pain comes from inflammation. Stem cells find that signal, chase it down, and break down the inflammation. Then over the next months, then regeneration starts to happen. And then the last fun thing is immune modulation. His heart rate was consistently in the 120s, which is why they didn't think he would survive surgery. A month later, he was at 78. One of the top stem cell doctors in the nation is a cardiologist in Texas. All his heart and stroke patients get stem cells now. He checks their EKG and does a video at month 1 and month 3, and the changes are incredible. So it's this whole new idea of we don't have to go in and cover up that knee pain or operate on that knee pain. The genicular artery feeds that knee, and if you put the stem cells in the blood, which is where they want to live, they find the signals and then they've changed the joint. We just did a really fun one this last week, or just heard the rest of the story. We did the stem cells about 3 weeks ago. Came in with such severe back pain, numbness going down both legs, hunched over, was getting ready this month, February, to do a back surgery. And I don't know how many of you guys have seen or been around back surgery. I don't wish it on my worst enemies, even after doing it personally. When it's needed, it has to be done, but it's never a good option. It's just horrible. And so he comes in, can't feel his legs, hurting. We did stem cells first couple of weeks. He's like, I'm not sure. Don't really know much about it. Just last week, he came in and told us he had canceled the surgery. He's got feeling back in his legs. And his wife walked him in and said, yeah, he even looks better, and his hair's getting thick again. I'm like, I don't want my hair to grow back. I don't miss combing hair. But he did really well and has canceled his surgery. And we just keep seeing stories like this over and over and over again. And the key is, this is our temporary space while we're building our whole new regenerative center. The key is getting cells that are minute 1, that are alive and viable from the best source on earth. The key is, are those cells alive when they go into your body? And key number 3, we'll talk about cost. It's only covered for leukemia and lymphoma right now. But the Mayo Clinic is in the middle of a $5 billion grant to see how many more diseases we can get approved for. With the new legislative changes, all the top regenerative doctors are on their way to Texas. We're going to do called Freedom of Medicine Summit, and it's going to be approved for tons more things coming up. So right now, the only downside is that it's expensive. When you look at doing stem cells, if you are willing to travel all over the world, you can find an average cost of about $11,000 for a whole body treatment. There's some places that'll sell you little pieces of it. For Mexico or Colombia, they do a whole body living cells. Can be the highest I've seen is actually $300,000. But then you'll see these bad players, hey, we have stem cells for $500, $1,000, $2,000. They're only doing that one branch. Remember that short thing? The MSCs. So if you have an inflammatory or an autoimmune issue, putting in some MSCs are not going to help you a lot. The MSCs can be isolated better, and then in other countries they do what's called clonal expansion. They'll pull out some stem cells, grow them in petri dishes, and so you're getting a copy of a copy of a copy. So it's still better than nothing. And if you can save a couple $1,000 by going to Mexico, you might be getting stem cells, you might be getting monkey cells, you might be getting saline. You don't know for sure what they're putting in you. With an FDA sourced lab where they do isolation, and we have a QR code on every single stem cell transplant that ties you right back to the birth certificate of that baby. So we know exactly where the cells came from. We know exactly if they were minute 1. They do post-viability testing, and if they don't survive the isolation process, the entire batch gets thrown out. They test it against sterile water. It has to be perfectly clean. It has to be alive. So when you get this combination of day 1 human cells from American labs without being messed with, and you put it in your whole body, you're now changing your health investment. Instead of looking at the cost, what's the cost of not doing well? And then you look at other places where they don't do this level of care. We just do it on a level that can't be done anywhere else. My dad's motto growing up on the farm was, there's always room at the top. And so if you do things the very best that they can be done, then it's going to be just fine. And so we just continue to do fun things. The furthest we've had somebody come is from Bogota, Colombia. So far, we've got patients on their way flying in from South Carolina and North Carolina. We're not just St. George based, but we want to make St. George the pinnacle of regenerative health. We want it to be just on a whole other level. I refuse to do it any less than the absolute pinnacle of what the science has now shown. Just yesterday, I had a lot of fun with a mom. She brought in her 2 kids, both with severe autoimmune disorders. One, the autoimmune attacked his pancreas, has type 1 diabetes. The other one, the autoimmune disease attacked the connective tissue. You see these circus performers that can bend themselves in half. A lot of them have this disease called EDS, Ehlers-Danlos syndrome, where their connective tissue doesn't work. And they get what's even called a heavy head syndrome, just sitting there, their head falls forward and basically is like cutting off their spinal cord. In the worst cases, it's horrible. Normal medicine says cover it up with steroids or take insulin the rest of your life. In September of last year, the big company Nature just published first ever type 1 diabetic cured with stem cell. They hardly ever use the word cured in medicine because all the medicine we take covers stuff up and they try to slow the decline. For now, the first time ever, we can say things like, the FDA won't let me say heal, but the Nature can say that they've cured the person with type 1 diabetes. The fun thing about this mom was that tears were coming down her face. She felt so guilty because she did not want to vaccinate her kid and felt like it wasn't the right thing. And he got really sick afterwards and then developed autoimmune disease and diabetes. And we talked about the science behind vaccine and toxins. I thought maybe there's a whole other discussion. Vaccines have their place, let's not go into that too much. But she felt like she had ruined her kid. And now to know that she could now do something to help him she was just literally was crying. She's so excited to have this stuff. It's the kind of fun we have now. When I haven't had any patient cry, they're so happy after surgery. They still hurt, pain medication, stuff that way. But we have lots of moments where people are super excited. Okay, next slide. I can get off track and start telling stories for hours. So we're not just a stem cell company. One of the most incredible things is Tanner, our amazing owner back here, came from San Francisco and got exclusive rights for the DEXA body scan. So you can come into our clinic and we offer this with our stem cells and people that aren't even doing stem cell therapy. You sit on our magic carpet, we call it, and it does a 3-dimensional scan of your body, showing you bone density, visceral fat, symmetry, and kicks out more data than you'll ever get in just a few minutes. You'll get this body composition score that will let you know what your body is doing, what it's like. And people make good decisions when they have good information. We give you this incredible information. Then we treat you like a world-class athlete, like Lance Armstrong and the cyclist. We put you on the VO2 max machine. You hook up this awesome oxygen mask, run on a treadmill, and we can measure how much oxygen your body uses. And then we can tell you how healthy you are and make decisions based on that. Then we can measure your metabolic rate. How many of us know how many calories we actually burn a day? We can tell you. Come in, you sit down, and you will know, are you at 1,600 or are you at 2,400? When you work out, what level are you at? What's your bone mineral density? The fat, the visceral fat is the most dangerous. When we carry fat around our organs, that's what kills you. So we can measure that now. So we do this whole body composition. We add a combination of stem cell and regenerative medicine. Then in our new facility, we're going to have everything from hyperbaric to red light to ozone. All of the things we now know from good data that make better humans healthy, that isn't pushed back from the hospital by insurance and regulations and all that other stuff. The stuff that actually works, we're all going to put together to make people healthy, happier, and better lives. And then if you need surgery, we're still going to be surgeons. We're still going to be things that people need. But hopefully we can avoid that as much as possible. Everything from how our body needs to function at that level. Okay? How are we doing on time? Am I doing good? Food's here. We don't want to talk too much longer about the head of food. One of the other keys is you want to be with people that have experience. Stem cell companies went from 400 to 1,800 in the last 3 years. The technology is now exploding. And we now realize we can get cells, we can keep them alive. So where should you get them? My experience coming from burn and wound care and cellular migration is what put me in this perfect position. Of my whole career, I've watched people try to regrow skin, regrow tissue, amputations. Every 30 seconds, somebody has a leg amputated in America. It's horrible. Diabetes is destroying us. So I've come from this background and experience in cellular technology and cellular migration. And then I'm gonna take this to a whole new level. Our experiences have been incredible. I've shared a couple of stories. I like to share as many as you want to hear. We have so many to share. Really almost incredible. In the beginning, I was amazed and surprised. Because I'm a surgeon, I still want to fix things. I was surprised these cells could do what they can do. But then you look at the science, and a bad knee needs new cells. And it just makes sense. The deeper you go into science, the more it makes sense. Cells know how to fix things better than I do. Brand new cells know how to fix things really well. So I was amazed and surprised. Now I'm still amazed, but I'm not surprised. One guy told me last week, I canceled my back surgery. I was amazed, but not surprised. I've now seen it so many times. One of our most incredible cases, I would say, let's tell you the craziest ones. So you're like, it can help that, it can for sure help me. And then the basic ones. Most crazy one, we've got any pickleball players here. Fastest growing sport in America. Didn't know what it was. I came from New York to here. Had a patient come in with 3 broken bones in their foot, and they said they were playing pickleball. And I said, pick what? And they're like, yeah, because it's intense. These people, they get really serious with this. So a guy's playing pickleball at Vernon Park, collapses on the pickleball court. EMS gets called, they shock him 10 times. You ever seen a body get shocked? It's a pretty intense experience. Only 8% survive. So he gets shocked 10 times. They get enough heart rate to get him quickly from there over the ICU. Months in the ICU with heart and brain damage. His profession, he was an FBI data analyst. He can't pass his field test, can't function at a 40% ejection fraction with his heart damage. Learns about stem cells, was looking going out of the country, realized he didn't need to go out of the country. It is stem cells. It is stem cell allograft transplant, to be more clear with the data. We didn't just poke him with some weird little snake sauce. We did a full body stem cell allograft transplant. 3 weeks later, follow up, how you doing? He's like, yeah, I feel like I'm eating better, so I feel a little better anyway, but I don't give it any credit yet. He said, by the way, I'm not a fluffy guy. I'm not going to just tell you this stuff is helping if it's not. I do data analyst. And by the way, if this doesn't work, I can ruin your life. I'm like, you're right. You have FBI access to everything. He literally told me, I will erase you if this doesn't work. I'm like, no pressure. I'm just a brand new surgeon just starting to play with this stuff. A year and a half, almost 2 years ago now. At the 3-month mark, how you doing? He texted back 3 cells. It's not a fluffy guy, so good. Everything in my life is improved. I've passed my field test. I'm riding motocross across the desert again, and my son just won the Baja 1000. I was able to be there with him. I'm like, some people say they ride motorcycles, and then there's Baja 1000 champions. That's a crazy one. Helicopters chasing him and all this fun stuff. So he was my most scary case, and it was okay. Took a deep breath. And then down to the simplest are just little things like back pain. I just hurt. And then improve. One fun guy that's on swim, does an adult swim meeting team, and he's like, I just want to improve my overall health. And sees his time has improved. His son at 25 years old is having such severe seizures that he's dislocating his shoulders. He did stem cells. Just 3 weeks, they've already noticed a huge drop off in number of seizures and how fast he recovers. And the 6 to 9 month mark is when the data shows it will be better. So, we have some incredible experience with this. It's hard to think what it's not good for. When you go to the national conferences, it's called the penicillin of our generation. It's going to change how we treat everything. There's already a country in Africa that approves stem cells for every non-communicable disease. They're going to prove to everybody else that you're going to save money if you do this first. Don't medicate, don't operate. First, regenerate. And even if you have to have surgery, we did a guy with really severe abdominal tumors. Did stem cell transplant. He had the abdominal surgery. That's normally a 5 to 7 day stay. At day 3, he was walking up and down the halls in the hospital. They sent him home. So even if you have to have surgery, this ability to have millions, which then turn into trillions of new cells, changes your health pattern. The deeper science is at what age should we do this to stop fat decline? Is it 20, 25, 30, 35? People with resources, the multi-billionaires, the Hollywood crowd that flies up to see me, they're doing it every 6 months or once a year. It's overkill. Trillions in your body at that point. But in the future, we'll have a pulse oximeter to put on. It's going to say you're at 35 trillion, we need you to be 50 trillion, be healthy. And we're just going to keep people healthy in a much better way. It's so fun to see where this is going. It's the coolest thing I've seen in 15 years of being a doctor. And it's so fun to literally help people in an entirely different way right here in St. George. So, the biggest question is how you find us. If you want to see the scan. Our temporary space is the Hillside Health Building, while our brand new regenerative center is being built. And I'll even afterwards give any of you my personal cell phone number. Text me, I'll call you back between patients. I will talk stem cells until I'm blue in the face. And any just general medical questions you have today. If I can save you a copay and a visit to the ER, and kind of a plastic surgeon guide, if you got something, just text me. We'll sew it up. Don't really know. Super fun. Okay, next. Everybody get that? We're going to be holding way more events. We're going to be upstairs on the 27th. And more events to come, more events to follow. We're going to be doing these regular days that just explodes. So excited we got to be the first. And then eventually we're going to be the biggest because this is exploding. It's so big. Okay? And the biggest question is what do you want to generate? And who? What will often happen is you'll think of something you're battling, or you'll think of someone. What about my mom? What about my this around me? Which is ironic, but today we are actually doing my mom's stem cell transplantation. She was in the same car accident that broke my dad's back in 3 places. But she wants to see him try it first, even though I'm the doctor. The biggest convincer of my mom was a PhD and raised 4 boys that she needed a PhD in psychology to be able to do that. And she's finally said, okay, you're right, all the science, all the data's there, I'm ready. So we're doing her today at 4:30. It's crazy. It's the first day we're here, the first day there is my mom. And I wasn't, mindset. It's just going to be awesome. So I'm glad we have chosen this. And let us know any, it's literally the coolest thing out there. I'm excited about it. Questions?
How does stem cells improve the brain and personality disorders or anything along that in that area?
Yes, really good. So back to that idea of the tissues that come from the different types of stem cells. So brain has this amazing barrier called the blood-brain barrier. So it only allows certain things into your brain. Stem cells can cross that, which is incredible. And so some of the incredible new studies we've done severe brain injury. We had a kid get hit by his motorcycle. You guys might have seen his story. I think I can share it. He's been very open with it. It's called Rev for Trev. He was on a road and a car U-turned right in front of him when he hit them on his motorcycle and then went kind of into the car. Although he was wearing a helmet, sheared his brain into 2 halves. We did stem cells a week later and posted a video of him walking for the first time since his accident. So brain trauma, brain injury, and then Utah State is in the middle of a huge dementia study, and we're getting stem cells to be one branch. Now, the data out of Europe on autism, on dementia, on other things, they can be a little more open than we can here, and so the studies on all that are just incredible. But I can't share the studies. The FDA says that's called claim and treat, but I can tell you that we're in stem cell and put in whatever you want to do. And look for the studies that aren't by the company. Look for NIH, big studies, and go read until you're tired. It's a good sleep aid. You know, read stem cell studies all night. It's super fun. But yes, there's lots of data on brain. The autism stuff is the most exciting. With autism now going to 1 out of 34 kids, they'll do is MRI of the brain, stem cell, post-MRI, and autism is almost completely solved. So we've done a few of those and so one was a really cool content creator. He could only do about 2 hours before he just lose it. Now he's sending me all the stuff he's doing his work 10 to 12 hours. It's super fun. So yeah, brain is a very reactive tissue. One of the crazy ones we did, a surgeon with a guy that ends back surgery, they cut one of his nerves, lost feeling in his leg for 9 years. We did a stem cell. They felt the cold tile for the first time, and then after about 3 months, he's now walking without a brace, walker, and anything else. Nerves don't regenerate. It's not else they do.
So is that just like a shock treatment?
No, that was the old way of doing it. They would just poke it into different places. Now we do a whole body transplantation. So you want to get the stem cells immediately out of the pediatric patient, and then isolate it, and then into your body. So the most common way is an IV transfusion. And so you come into our transfusion centers. Melinda talks. She's really good at getting your IV access. So the science is incredibly technology advanced, and yet the process is so simple. You come in and you do an IV transfusion, and it changes your health.
Can your body reject?
It's a great question. So when we first started, we did a lot of blood typing and matching and all that stuff. What we now know and understand is that when you and I donate blood, I have to be A positive and you have to be A positive, right? Because red blood cells have bumps on them called antigens. And yours don't like mine, and mine don't like yours, so that's how you reject. Stem cells are non-antigenic, meaning your stem cells and my stem cells are almost identical. So it's fantastic. You don't have to do blood tapping for a pure. If you didn't have pure stem cells, yes, it'd be very dangerous. You could have graft versus host. If you get minute one pristine, and in the old ways, when you get off even more of the science, they used to use chemical bait, and chemicals, they would kill fat and other cells and hope some stem cells would survive, like when they take it out of your bone marrow. Everybody here's heard of a bone marrow transplant, right, for cancer patients. What are they going after in the bone marrow? Stem cells. So stem cells aren't new, it's just our ability to get them without going into your bone marrow or your fat is the amazing new technology. When they take that minute one blood, they have a computer algorithm that can measure the individual weight of every cell. And so the red and white blood cells that would give you an immune response are isolated and kicked out. And what's left behind is this matrix allograft of stem cells, growth factors, exosomes, proteasomes, and extracellular matrix. So that's why I almost like the term stem cell plus, because what we put in isn't just stem cell. It's everything that grew that human baby minus the stuff you react to, which is the red white blood cells.
When you say vetted, for US, what do you mean?
Yeah, so that means we only use US-based lab that does all of the vetting, all the testing for the smoking, drinking, vaping, tattooing, the bird, and they're even so selective that it's only their first child when the mom is young and healthy. It can't even be child number 3. It has to be first child. I don't know if I clarified that. And some people aren't that selective. They'll be like, we'll use anybody's blood. We don't.
And how do you extract stem cell from the child?
It's like a computer algorithm based on cell weight. So it has to be the minute the baby's born. So it can't even, yeah, so it has to be even a C-section. That's how technical the science is. Because they have to know the minute the baby's going to be born, and then you get the stem cells right there because the baby's born. And the cool thing is when you do the transplantation, all the joy of that baby birth seems to be in these cells. Like there's a really cool, joyful moment that brought those cells, and this person that wants to regenerate. It's a really cool moment when they get their new cells.